Snoring is annoying and embarrassing. It keeps your partner up at night, disrupts the quality of your sleep, and increases the chance of other health issues, diseases. Though occasional snoring is not something to worry about, regular snoring is not something you should ignore to best support your long-term health. Dr. Chris Payne has extensively studied oral sleep appliances that treat sleep apnea. His additional training in orthodontics gives him a broad perspective to evaluate jaw and airway problems and to assist patients with chronic snoring issues and recommend the right products to best support them. His office works closely with sleep physicians to treat patients with anything from mild to severe sleep apnea. So what is this sleep apnea about? Well, sleep apnea is a common sleep disorder. Over 100 million people across the globe suffer from this sleep disorder, including 22 million Americans. Usually, this sleeping disorder occurs when the upper airway gets repeatedly blocked while sleeping. In such a situation, either your breathing gets stopped or becomes very shallow. These episodes can occur repeatedly, disrupting your sleep and risking your overall health and cognitive function. When left untreated, sleep apnea can cause any of these: snoring, extreme fatigue, and other serious health issues like uncontrolled blood pressure, cardiac disease, and trouble focusing. Sleep apnea can be classified into three types: obstructive sleep apnea, central sleep apnea, and complex sleep apnea. Each of these conditions occur in different circumstances and requires a different treatment method. Obstructive sleep apnea is extremely common in adults. It occurs due to partial or complete blockage in the airways during sleep. This mostly happens due to the collapsed soft tissue at the back of the throat. In the long run, it not only affects the sleep of that individual, but also reduces the flow of oxygen to vital organs, such as the brain, liver, and heart. Central sleep apnea is somewhat different from obstructive sleep apnea. It doesn't block your airways. Rather, it is related to the dysfunction of your central nervous system. Among the three, complex sleep apnea is the most serious type, in which doctors prescribe emergency treatment. In this type of sleep apnea, an individual goes through both central and obstructive sleep apnea. Understanding your condition and the cause of the apnea and getting the correct medical diagnosis is very important. This is why it is important to have a sleep study. Sleep apnea is more than just snoring, and it's important to seek help if you experience prolonged symptoms. Other symptoms of this sleep disorder include daytime sleepiness, a sensation of gasping while sleeping, frequent waking during sleep, restlessness during nighttime, frequent urination at night. It can lead to high blood pressure or hypertension, heart diseases, type 2 diabetes, acid reflux, weight gain. Now, let us dive into the factors that can increase the risk of developing obstructive sleep apnea in adults. Though some of the factors are hereditary, most are due to lifestyle changes. Some of the risk factors include consumption of alcohol and sedatives, extensive smoking, obesity, a narrow airway, higher neck circumference, low immunity, allergies and other anatomical reasons, pregnancy, cardiovascular diseases, family history of sleep apnea, large tonsils. Sleep specialists and dentists also use the stop bang as a screening tool for sleep apnea. Questions are asked such as, do you snore? Are you tired? Has anyone observed you stop breathing? Do you have high blood pressure? Are you overweight? Are we older? Have a larger neck circumference, or male? Many of these can be risk factors for sleep apnea, but anyone can have sleep apnea. An individual can also use an app on a smartphone to record and listen for snoring. SnoreLab, Sleep Cycle, and Snore Control are some of the most popular snoring analyzers available in the market. Remember, an app can only tell you so much. If the symptoms persist, do seek professional help. In order to medically diagnose sleep apnea, a sleep study ordered by a physician is necessary. Sleep specialists perform a sleep study to identify the amount and severity of events during sleep. The specialist checks when your breathing stops or slows down during sleep, while also examining your blood oxygen level, the activity of your respiratory muscles, and brain and heart functionalities while in rest. The two most common types of sleep studies are the polysomnogram, PSG, and home sleep test, HST. While PSG is performed at a sleep laboratory, HST can be done from the comfort of your own home. Sleep specialists also use the Apnea-Hypopnea Index, AHI, to measure the severity of your sleep apnea. Clinically, if you stop breathing for 10 seconds or more while sleeping, you may suffer from sleep apnea. If your AHI is 5 to 14, it's confiscated mild sleep apnea. 15 to 29 is moderate, and greater than 30 is severe sleep apnea. When diagnosed with sleep apnea, there are CPAP machines and oral appliances that can help treat the condition. We recommend oral appliances to patients with mild to moderate obstructive sleep apnea, or if they struggle using a CPAP. CPAP, continuous positive airway pressure, or PAP, is an effective oral appliance for all types of sleep apnea, especially when your AHI is higher than 30. Dentists who make sleep appliances can help you with customized oral appliances to treat sleep apnea more efficiently. These appliances are designed according to patients' specific problems and needs. Some of the customized oral appliances available in the market are Herbst Appliance, Dorsal Fin Appliance, Elastic Mandibular Advancement or EMA, TAP Appliance. Oral appliances treat mild to moderate sleep apnea by pulling or pushing the lower jaw forward. These devices keep the tongue and lower jaw in an anterior position that reduces the blockage of the airways. When the airways remain open, the risk of snoring reduces while sleeping. Now, it's important to understand the efficacy of these devices. Though oral appliances are effective for patients with mild to moderate symptoms, they can also be considered in instances of severe sleep apnea when the patient cannot use CPAP. The effectiveness of these devices may vary from patient to patient. For some, obstructive sleep apnea goes away completely, while for others, alternative treatments are needed. Also, to experience the best results, always try to combine lifestyle changes with your oral device. We consider this combination therapy. Though oral appliances do not have many side effects, it is possible to experience discomfort using them. In most cases, this feeling of discomfort improves with time. However, if you feel discomfort in the joints and muscles of your jaw for a prolonged time or have changes in your bite, follow up with your dentist to manage these problems. We recommend keeping your oral appliances clean for oral hygiene and the durability of your device. Consider brushing your teeth before usage, rinsing and brushing your appliance, using a cleaning tablet to soak your appliance. Usually, dentists ask for your medical history while making customized sleep appliances for you. This process is important to meet your specific needs and to maximize the benefits of the device. The common steps involved in starting the oral appliance therapy are screening, diagnosis, customization of the oral appliance, positioning of the device, follow-up visits. Apart from using customized oral appliances, lifestyle changes play a crucial role in mitigating the symptoms of sleep apnea. Without proper treatment, this sleep disorder may stress your body, its internal system, and lead to different health issues. In addition to CPAP or oral sleep appliances, you can improve the symptoms of sleep apnea to a certain extent by making positive lifestyle changes like reducing alcohol consumption, quitting smoking, avoiding certain medications like opioids, turning down the thermostat, keeping your room dark during bedtime, choosing the right pillow, using lavender essential oil, maintaining a consistent sleep schedule, avoiding caffeine intake, limiting water intake before sleeping, avoiding late dinners, changing sleep position, etc. Now that we know about the non-surgical options and lifestyle changes to treat sleep apnea, let's discuss a bit about surgical options. Although there are many non-surgical options to treat this disorder using oral appliances, CPAP machines, or lifestyle modifications, if none of these methods cures your condition, then your doctor might suggest surgery. There are several surgical options to treat this sleep disorder. Some of these surgeries are nasal surgery, palate surgery, tongue surgery, maxillomandibular advancement, anterior-inferior mandibular osteotomy, hypoglossal nerve stimulator, etc. However, surgeries are less common, and thus, patients must consider its recovery time, success rate, and risk level before opting for it. Apart from all the treatments I discussed, there is another way to reduce the symptoms of your sleep apnea: throat exercises. Throat exercises are effective at strengthening your throat, tongue, and facial muscles. Practicing these exercises on a regular basis can help you to deal with your snoring and other breathing issues. Some of the exercises that can help you to reduce the symptoms of sleep apnea are tongue stretch, tongue slide, tongue push-up, kiss lips, cheek hook, breathing exercises, etc. Though sleep apnea is a serious condition that may cause many other health issues, it can be treated with proper diagnosis and the right treatment. Remember, improving your quality of sleep is imperative for leading a quality life. Recently, Dr. Payne published a book, Stop Snoring: Restful Nights and Better Days Ahead, which discusses sleep apnea, its causes, risks, and solutions in detail. I believe this book will help you to understand this disease better and find the right way to deal with its symptoms. You can always refer to the book to learn about different oral sleep appliances that can help you to have a restful sleep and improve your alertness, efficiency, and quality of life. Remember, sleep is one of the most important factors in our physical and mental health. It's important to sleep well. If you have any questions about how oral sleep appliances can help you, please feel free to visit our website, www.danvilledentalassociates.com. Also, feel free to call Dr. Chris Payne at 434-799-8825 for a consultation. Take care, sleep well, and have a great life.